Hello and welcome to Peripal. My name is Dr. Faiza Brunner. I will be introducing you to the PeriSafe system used in the APD. I would like to give you an overview and explain how the PeriSafe system works in the APD. You will also get to watch short videos along the way explaining the various steps. We will go through the various components of the PeriSafe system in the APD. Here I will talk in detail about the preparation of the PeriSafe system, connection of the transfer set to the patient line, disconnection and replacement with a new protective cap, and finally, cleaning of the device. Lastly, I would like to again stress on the crucial steps in the summary. As a start, let us now watch a short video on how APD works with the PeriSafe system.
Place the peritop onto the slider. The Dialysate tube is positioned on the left canal. The latch of the pull-off cap is placed in position over the blue knob. The patient line, which already has a peri adapter in place, is positioned onto the device. The device is closed and the lever is moved all the way to the top and brought all the way down. To secure connection, one half of the Periclick is placed over the tubings, and then the patient line is removed gently out of the peritop. The second Periclick is then attached. The line is now secure for the night. The old cap is removed and the PeriSafe cover is closed. It remains so overnight. In the morning, with clean hands, the device is opened. One Periclick is first removed. The patient line is inserted into position, and the second Periclick is then removed after that. The tab of the folier is left out of the device before closing. The tab is then removed. The lever is moved all the way to the top and then all the way down. Check to see if the cap is on and closed. Push the lever up. Open the device with close but sterile hands and remove the patient line. Make sure that the cap is on top. First, spray with 70% isopropanol and wipe dry. The isopropanol is sprayed again and left to dry. This step is repeated with the slider in start position. And now you may close the lid.
The components that we need for APD is as such: the PeriSafe device. You have the peri adapter, which is connected to a patient transfer line. This is only done by a healthcare professional and usually done every 6 months at a healthcare center. You have the APD peritop, which is disposable, and for APD especially, you have the Periclick, which secures the patient line. Now that you know the main components of APD with the PeriSafe system, let us watch the initial preparation steps. It will show you how the various components are inserted into the device.
Always at the start, with clean hands, one must disinfect prior to loading the device. Outer surface is sprayed with isopropanol alcohol and wiped dry. Then spray again with alcohol and wait for it to dry. Open the device lid, set the lever to finish position with the slider on top. Spray with isopropanol alcohol and wipe it dry again. Now it's sprayed and you wait for it to dry. Move the slider to start position and repeat the whole steps again. Place the peritop onto the slider. The Dialysate tube is positioned on the left canal. The latch of the pull-off cap is placed in position over the blue knob. The patient line, which already has a peri-adapter in place, is positioned onto the device. Close the device lid now.
Please pay attention to these salient points that we watched in the previous video. These steps are very important. Insert the peritop, which will give you a feedback with a click sound if inserted properly. Then you insert the dialysate tube onto the peritop. Here again, you will get a click feedback. The dialysate tube is always inserted onto the left canal and is completely pressed down into position. The protective pull-off cap is then looped over the blue latch. Then the peri-adapter is positioned onto the peritop, and then the patient transfer set is inserted into the groove on the PeriSafe device. Please make sure that all the components are now inserted correctly. Check these steps again. Make sure that the patient line is fully inserted into the peritop. The lid should not be clamping the dialysate tubing. The white head of the patient line is fully pushed in with the click here. Protective cap is looped over the blue latch. The peri-adapter is positioned onto the peritop and then pushed into its groove in the PeriSafe device. Then the twist-on connection of the patient transfer is in closed position. Now that you have made sure that all the components are inserted correctly, we will move on to the second step, the connection of the dialysate tube to the patient transfer set. Please first watch this video.
To uncap, move the lever all the way up and bring it all the way down. Now you may open the device lid. To secure connection, one half of the Periclick is placed over the tubings, and then the patient line is removed gently out of the peritop. The second Periclick is then attached. The line is now secure for the night. The old cap is removed and the PeriSafe cover is closed. It remains so overnight.
I would like to stress on how the Periclicks were attached as was shown in the previous video. First, attach the Periclick onto the peri-adapter, then remove the transfer line from the device and dispose both the old protective caps. Once you have the patient line in one hand, attach the second part of the Periclick now. A properly attached Periclick looks as shown in picture number 4. Now you can close the device lid for the night. The continuation of the procedure the next day involves attaching a new protective cap and disconnecting the patient line. Please watch the next video showing these steps.
In the morning, with clean hands, the device is opened. One Periclick is first removed. The patient line is inserted into position, and the second Periclick is then removed after that. The tab of the folier is left out of the device before closing. The tab is then removed. The lever is moved all the way to the top and then all the way down. Check to see if the cap is on and closed. Push the lever up. Open the device with sterile hands and remove the patient line. Make sure that the cap is on top.
Removal of the Periclicks. After the exchange is done overnight, in the morning we will insert the patient line into the PeriSafe device again. But first, the Periclicks have to be removed, and I will show you how. Remove the first Periclick from the peri-adapter. Now place the peri-adapter into the peritop with the remaining Periclick facing up as shown. Once it is in its groove, the second Periclick is now removed from the peri adapter. How is the protective gold tab removed? The protective gold tab is left out of the device. The lid of the device is then closed, with the protective gold tab sticking out of the device as shown. Now you can safely remove the gold tab. The replacement with a new protective cap is always done with the device lid closed. For better visualization, the picture below has the lid open. Make sure that the lever is completely pressed down. The lever is completely pressed down for 5 seconds, which makes sure that the protective cap is fully pushed into the peri adapter. Check visually to see that the protective cap is indeed fully on. Now you can move the lever all the way up so that the patient's transfer set is independent for removal. Your procedure is almost complete. The last step is, of course, cleaning and disinfecting the device. We will show you how with this last video.
Recap the patient line, remove and discard the peritop. In finished position, spray with isopropyl alcohol and wipe it dry. Again spray it with alcohol and now wait for it to dry. Move the slider to start position. Spray with isopropyl alcohol again, wipe it dry, and repeat, and wait for it to dry. Close the lid and you're done.
Cleaning and disinfection. The cleaning of the device is essential and should be done before and after every cycle with PeriSafe. To clean the surface, it is first done with the device lid closed and with the device lid open in the end position of the slider and start position of the slider. How is the cleaning done? Surface is sprayed with 70% isopropanol. You wait for 30 seconds and wipe dry with clean disposable wipes. Surface is again sprayed with 70% isopropanol. Leave it to dry now completely, and these steps are repeated 1 to 4 all over the surfaces. As a summary, I would like to stress on these important steps. During the preparation, please do not remove the protective golden tab overnight. This tab remains on. Protective pull-off cap is then looped over the blue latch over here. The Dialysate tube must be pushed into the left canal completely. The peri adapter is placed onto the peritop first over here, and then it is positioned into its groove onto the device. While attaching the Periclick, it's also important that the first Periclick is attached onto the peri adapter, as shown here. Then the transfer line is removed from the device, and then the second Periclick is attached top down. When continuing the procedure the next morning, make sure the first Periclick is removed, and then you insert the patient line in. The second Periclick is then removed after that. The protective gold tab always remains outside of the lid. When attaching the protective cap, make sure that the lever is kept pushed down. This ensures that the cap is on correctly. This is a checklist for APD steps. I will not go through them individually, but this is a summary for you to look through while doing the steps. Alternatively, you can also have a step-by-step guide with pictorial representation with short explanations assisting you. Thank you for your interest. Please also watch our presentation for CAPD and peri adapter at our website. Bye-bye.